Welcome back. Did you know meningitis claims the lives of at least 1 in 10 infected individuals and leaves 1 in 5 with lasting disabilities? The CDC is contemplating updating age recommendations for meningitis vaccinations, potentially leaving numerous children and young adults vulnerable. One of our next guests contracted meningococcal meningitis during his college years, resulting in the amputation of all of his fingers and both feet. Here now to tell us more are Meningitis Survivor Jonathan DeGuzman and Nurse Practitioner Dr. Wendy Wright. I want to thank you both so much for joining me.
Thank you so much for having us.
Thank you.
Now, Dr. Wright, could you please explain what meningococcal meningitis is and how it is contracted?
Yes, so meningococcal disease is a bacterial infection that is spread through respiratory droplets. So something as simple as sneezing or coughing can transmit this bacteria. But also it's acquired through kissing or through sharing of utensils or, soda bottles, things that adolescents often routinely engage in, which is what puts these adolescents at an increased risk. This bacteria can take the life of a healthy adolescent within 24 hours. And you said yourself, about 10 to 15% will not survive this bacterial infection. And if they do survive, about 20% or 1 in 5 are left with severe disabilities, including amputations that I know our colleague here today, Jonathan, is going to speak with you about. Our best defense is a good offense. So we've got a vaccine program that can help to prevent this in our at-risk population.
Yes, and I definitely want to say that, Jonathan, your experience with meningitis has been life-altering. Can you share with us how the disease has impacted your life and changed your perspective?
Yeah, and back in 2005, I was your normal college student, just turning in a paper for one of my classes, and I did have flu-like symptoms. And, like any normal person, just taking care of this flu, I just went home, drank plenty of fluids and rested, and I took a nap. But the next thing I remember, it was 12 days later, and I woke up from a coma, and doctors were frantic to save my life. And so in order to save my life, they had to amputate all 10 of my fingers and both of my feet, which was the result of this bacterial infection, which left me permanently disabled. So as a dancer before, I used dance hip hop, salsa, merengue. It really devastated me knowing if I'd ever dance again. So it not only affected me physically, but mental health wise, I had to relearn how to be normal again and how to kind of move forward and be independent. And so, I rely on prosthetic legs, but also I rely on wheelchair just to get me through a normal day and just to really use physical therapy and occupational therapy to help. Now I'm here with Dr. Wright, just really educating the community about the importance of this vaccination. And if I knew about it back in the day, I would have gotten vaccinated.
And I also want to expand on the fact that you mentioned that you were a college student, which means you're very young. Dr. Wright, the CDC is considering revising age recommendations for meningitis vaccinations. How might this potential change affect adolescents and other young people who are at increased risk, and what implications could this have for public health?
So today we give 11 to 12-year-olds what's called MenACWY. Protects against 4 strains or serotypes of bacterial meningitis. That's a great time to give it because 11 to 12-year-olds are often mandated to come in and get a Tdap or tetanus, which is mandated in many states. So we pair it together. Almost 90% of children actually get the meningitis vaccine at that time. Then we bring them back at 16 and we give them a booster. The purpose is to really carry them through that period of time, like Jonathan, when they're doing those activities that really keep them at a higher risk. The problem is only 61% actually come back and get that second dose. So if we eliminate the dose they're already getting at 90%, we very much fear, Jonathan and I, that we're going to lose the momentum that we have in this country. There is a 90% decline in bacterial meningitis since the introduction of the vaccine. So we don't think it's a good time to take our foot off the gas pedal, that we want to continue to protect with both of these doses to give our adolescents the most optimal protection that we can give them.
And Jonathan, expanding on that, what message do you have for parents and young adults about the importance of vaccination?
Yeah, definitely for sure. For me to educate the community, I would say parents to talk to their healthcare providers about, asking about this vaccination, especially for their young children, and to for the young adults to really, tap into their resources on campus about, especially in their healthcare department, about, vaccinations that are required or anything like that, just to really get the mouth out there of just information of that this vaccine is available and that this can be prevented.
Dr. Wright, could you elaborate on the different causes and risk factors of meningitis just to let people know maybe what are some signs or some symptoms that people can look for?
Sure. So, talking today about bacterial meningitis, it's a rapidly progressing infection. Oftentimes, by the time we know they have bacterial meningitis, it's often very, very advanced. So, headache, high fevers. You heard Jonathan today, flu like symptoms. And so, I tell my team every day in my clinic, don't make me have to diagnose it because I bet I'll miss it because it looks like everything out there, everything else until it doesn't. So, getting our children at 11 to 12 and 16 up to date with those vaccinations gives us the best opportunity to prevent this from happening. Today, Jonathan and I are partnering with Sanofi to urge the ACIP committee to really look at the successes that we've had with this vaccination program and to not change it. And for our viewers, if they're interested in more information, they can go to bit.ly/meningitis vaccination, and there'll be lots of great information for them.
And Jonathan, I just want to mention that you've shown incredible resilience and determination in overcoming the challenges posed by meningitis. Can you just tell us, how do you approach your role as a state employee helping those with disability, and what motivates you to continue to do this work?
I think also education is really important. For me, being a voc counselor for the state of California, I just really like providing the service of helping individuals with disabilities find employment, but I'm also working with students between the ages of 16 to 22. So, I do speak with parents about, pre-employment transition services, but also, when they want to talk about, my disability, I do talk to them about, oh, the vaccine is there and it's available. And, just kind of a cautionary tale of letting people know that this vaccine is available. Just being an educator and partnering with Dr. Wright about, this information and that it is preventable. That's my goal for this year.
And Jonathan, I want to thank you, just for taking the time to speak with us, share a little bit about your journey, and, really talk about the importance of educating the community, as well as Dr. Wright. I want to thank you as well for taking the time to educate our community and really let people know the importance of vaccinations and just letting people know why it's important to stay on top of your health, especially when we're talking about adolescents and young people. It's a demographic that doesn't often think about health, but I feel that this segment has really shown why it's important to. So I want to thank you both so much for your time.
We thank you for having us.
For more information, you can visit the website at bit.ly/meningitis vaccination. Don't go anywhere. We'll be back with more Open right after this.